I am currently on board the MV Hondius, and what's happening right now is very real for all of us here.
This is not the same as COVID was.
Today we're breaking down the latest on the Hantavirus, specifically the very concerning but supposedly contained outbreak on a cruise ship that's making headlines worldwide. As of this afternoon, Wednesday, May 6, 2026, we have new developments on the MV Hondius incident. 3 people have died. Multiple others are confirmed or suspected cases. And the ship is now en route to the Canary Islands under strict protocols. This is not a new pandemic sweeping the globe. Far from it, but it is a rare and serious event worth understanding. I'll walk you through what the Hantavirus actually is, the full timeline of this cluster, today's updates from the World Health Organization and other health authorities, and what it means for the rest of us.
It's designed to live in animals, it's not designed to live in us.
Stick around to the end for prevention tips and why experts say the public risk still remains relatively low. Let's dive in. What is Hantavirus? First things first, Hantavirus isn't one single virus. It is a family of rodent-borne viruses found worldwide. Humans typically catch it through contact with infected rodents' urine, droppings, or saliva. Think cleaning sheds, inhaling dust in infested areas, or rarely a bite. There are different strains. In the Americas, they often cause hantavirus pulmonary syndrome, or HPS, a severe respiratory illness with flu-like symptoms that can progress to breathing failure. Fatality rates for symptomatic cases can be around 30 to 40% without supportive care, though many exposures historically have been mild or asymptomatic. Importantly, historically most strains do not spread easily person to person. The big exception to this, the Andes virus strain in South America, which has documented limited human-to-human transmission in close contact setting. No vaccine or specific antiviral exists. Treatment is supportive care in a hospital. Globally, cases are rare outside of specific rodent hotspots. To put things in perspective, in the United States, the Centers for Disease Control has recorded only 890 confirmed cases since surveillance began in 1993. Roughly a handful per year. Most are in the western states. Sporadic cases pop up elsewhere, like a couple reported in Taiwan this year. Outbreaks of the hantavirus are extremely uncommon, and large clusters like this one on this ship basically unheard of until now. The virus does not survive long outside hosts, and historically isn't airborne like the flu or COVID in casual setting. This is why health officials are treating the current situation as an isolated one. Now on to the big story. The MV Hondius, a Dutch-flagged expedition cruise ship with about 147 passengers and crew from 23 countries, departed Ushuaia, Argentina in late March to early April 2026 for a route including Antarctica, South Georgia, and remote Atlantic islands before heading to Europe via Cabo Verde. Symptoms started appearing in passengers in early April.
We're not just a story. We're not just headlines. We're people. People with families, with lives, with people waiting for us at home.
The first known case was a 70-year-old Dutch man who fell ill around April 6th with a fever, headache, and gastrointestinal issue. He died on April 11th in St. Helena. His wife, also Dutch, her health deteriorated after flying to Johannesburg, and she passed away on April 26th. Lab later confirmed this as hantavirus. A third passenger, this one a British national, was evacuated to South Africa and is confirmed positive, remaining in intensive care as of early reports. A fourth death occurred around May 2nd aboard the ship. By May 2nd, the United Kingdom notified the World Health Organization of the cluster. Lab testing in South Africa confirmed the Andes strain, which is the one capable of limited human-to-human spread. As of the World Health Organization's May 4th disease outbreak news, there were 7 total cases, 2 lab confirmed, 5 suspected, 3 deaths, 1 critically ill, and others with mild symptoms. The ship was anchored off Cape Verde, which denied docking as a precaution. Do me a favor and click that like button. Subscribe to this channel to stay informed on updates about the hantavirus and hantavirus news. Fast forward to today, May 6th, updates continue to emerge. Lab confirmations have risen. Reports indicate that at least 3 to 5 confirmed cases, with a total suspected or confirmed of around 8. 3 additional patients were evacuated to hospitals today in the Netherlands, Germany, and 1 confirmed case treated in Switzerland. The ship left the waters off Cape Verde and now is heading to Tenerife in the Canary Islands of Spain. Spanish authorities granted permission to dock under international humanitarian rules and strict health protocols. Passengers remain on board with enhanced infection control, with no one disembarking yet without screening. The World Health Organization is coordinating with multiple countries, and the ship's coordinator, the ship's operator, Oceanwide Expeditions, and health agencies. They've noted suspected human-to-human transition in this close quarters setting, but emphasized that the overall risk to the general public is still low, with no evidence of community spread beyond the ship. Africa CDC and others seem to echo this, that it is serious but a contained event. Background investigations point to possible initial rodent exposure during the South American stops. No prior cases were recorded in the exact departure province, but the virus is endemic in parts of Argentina and Chile. Experts like those at the WHO, Spain's Fernando Simon, and infectious disease specialists stress not to panic, that this event isn't COVID-level contagious, global risk is low, and no travel restrictions have been recommended at this time. They're focusing on contact tracing, supportive care, and rodent control best practices. For everyday prevention for the average person, avoid rodent-infested areas, seal homes, use masks and gloves when cleaning droppings, and ventilate spaces. If one develops fever, muscle aches, or shortness of breath after potential exposure, they recommend to seek medical care immediately, and that early supportive treatment saves lives. Polymarket even launched a hantavirus pandemic this year bet, currently at very low odds, reflecting the contained nature. So to sum it up, as of this afternoon, a tragic but isolated hantavirus cluster on the MV Hondius has claimed 3 lives, with several confirmed and suspected cases. The ship is en route to safe disembarkation in Spain under medical oversight, with no signs of a wider outbreak at this time. Hantavirus remains rare, rodent-driven, not easily transmissible in most cases. You can stay informed via sources like this channel, or official sources like the World Health Organization or the Centers for Disease Control on their official websites. What do you think out there? Is this concerning? Is this overblown? Drop your thoughts in the comments and hit like if this helped. Subscribe for more real-time health updates, and I'll see you tomorrow. Stay safe out there.